Is it working? Oh, it's working. So we were having some technical difficulties for some reason. It wasn't wanting to go live on Facebook, and oh, look at that! Now it's actually showing that we're live. Yay!
Hey!
Sorry, guys, we're running.
Nice to be alive.
Yeah, we're running about 10 minutes late, but we are here. So I just want to introduce Alan Ogden. He is the Glutathione Authority, and the reason that he is the Glutathione Authority is because he has a degree in pharmacognosy medicine. He has 4 degrees in nutritional medicine. He has degrees in geriatric medicine, pediatric medicine, an energy medicine degree. He has 40 plus years of experience and education in the health industry, and he continues to stay really apprised of the latest and greatest that is going on in research, constantly looking at what the universities are up to, new patents that are being filed, new studies that are being published on PubMed. I can't even begin to read those, to be honest. I just think they're so freaking boring, and I don't even know how to read them. And I found out when I tried to read one time that I was doing it wrong because I got bored after like 20 minutes. And Alan was like, you're not even supposed to read that part. You're supposed to skip it. And I was like, so there's actually a way to do this, which is one of the things that he learned in school, how to read a study. And so he has just the most amazing knowledge base, and I feel really blessed to be welcoming him to the table as the Glutathione Authority and to be able to support him in educating you guys in all of the latest that's coming down the pipeline. And we truly hope to be your reliable source on how to optimize glutathione and a lot of other wonderful things that we choose to talk about when it comes to proactively supporting your health. So thank you so much for joining us, Alan.
You're welcome. Thank you. Thank you for having me. And it's great to be in your kitchen as always. And nothing sort of more tense than technical difficulties, right? 'Cause you really don't know what to do when you're having some technical difficulties.
Yeah, it's true.
Anyway, great to be here. I am excited to be with Harmony. For those of you who don't know Harmony, Harmony has education in pranic healing, emotion code, body code, clinical hypnotherapy. She has created her own program. She runs a clinic. She sees clients on a daily basis for clinical hypnotherapy. She has amazing skills in that area, and it fit right in with my energy medicine degree. But more than that, I grew up in an age without computers, without cell phones, and I'm one of those guys that when your grandkids ask you what was your first computer or whatever, it's like what computer did you use in school? It's like there was no such thing. Have you ever heard of an abacus? And most people have to go look that up, what an abacus is. But anyway, I didn't grow up with social media. Harmony grew up with social media, and so when I needed somebody to capture me talking and getting a message out there, Harmony stepped up, and I'm really grateful for you for doing that. It's been super duper for like 4 years, 5 years almost, right?
Yeah. I think we've been doing this for about 4 years now, which is absolutely spectacular. And for any of you guys that have friends that you want to share this information with that aren't on Facebook, we have a Glutathione Authority YouTube channel where we actually share all of the live events, and there's lots of other great videos that Alan does that are little snippets of health information that are anywhere between 3 and 10 minutes that you can absolutely go through and check out as well.
So tonight we're going to talk about 21 drugs and counting. And now we're not going to talk about 21 drugs, just so we make this clear. We are not talking about 21 drugs. What we're talking about is when I was doing my geriatric internship, we had a patient come in. She was in her 90s, she was 92 years old. She was incontinent, incompetent. She was just a mess. And her family brought her into the ER because they thought she was having a cardiovascular episode. Anyway, she came in and she was immediately put over to the geriatric team. We had a team of people. She immediately was put over to the geriatric team because she was on 21 drugs. So one of the things that a geriatric team would do is evaluate the patient and try to get a grip on their overall health. So ordinarily what would happen to somebody on 21 drugs, they would get to see a doctor and they would get more drugs. So it would be 21 and counting. And that's literally what had happened to this lady over a period of time. different doctors, different locations, different things, and every doctor had told her the same story. This is a medication you're going to need for the rest of your life. And, so to her it was just all confusing, and she couldn't handle the drugs. We didn't know if she was taking the drugs. So what we did in the geriatric practice was, because they're in the hospital, we took them off all of their medications, really to see what exactly we were dealing with. So we took this lady off all of her medications, really had a close look at what was going on. This is all very supervised and very safe to do this. And when she left the hospital, she was talking, walking, she went back to her own apartment. She actually invited the lead doctor over to her place. She made him dinner, and he had a picture in his office after that of him and her having dinner and a beer together. And he was very excited about that. And she was on one medication, one full medication, and a half of a pill of another medication. So this is a case where this person was literally being medicated out of her mind and out of her body and out of sense. So that's what I wanted to talk about tonight, because there's something called a drug pyramid. And it's a little known thing, but a drug pyramid is something that you're not going to find anybody in the industry talking about it, but I'm going to talk about it.
Is it a little known thing because it's known to very little people?
Yeah, that's right. and it's something that nobody would really admit to, but in my practice, what I noticed was if people could be put on one medication for something, and sometimes it's very necessary. I'm not against medications that are required for you to continue living. I don't ever want to give anybody that impression, but if we can get you on one medication or two, there are going to be side effects to that. And generally what happens, instead of evaluating the patient to see if their condition is still the same, and could they be removed, could some of those medications be reduced or removed, another medication is added to counter the side effects. Clinically, there is no clear direction for practitioners when you get 3 or more medications going into the same body at the same time. There's no clinical trials, there's no clinical studies. So when we have a protocol right now of 7 medications, a minimum of 7 medications. We have a little visitor tonight, and she's coming in and out. Anyway, 7 medications. You have 7 medications for at least, sometimes it's 9 medications for a cardiovascular event. There is no clinical trials that show that that amount of medication is actually effective long term. There's nothing. Those are all looking at different symptoms that happened in that patient, different things that happened, and they give you this pile of medication and send you home with it. So once again, I just want to reiterate, I am not against medication for the purposes. I just had to use some in the summertime. I had a very, very overwhelming infection, and so I used an antibiotic. And why wouldn't I? It's there. I used it for 2 weeks. It took care of the infection, and then I let my body heal after that. What was actually scheduled for me at that time was another visit with the doctor. Now, if I would have attended that visit, what would have happened? This is exactly what would have happened. I was on the antibiotic. He would have done an evaluation. He did a very brief evaluation, and he booked me for a test in the hospital. If I would have gone at that time, I would have shown some significant symptoms that he would have been very intense about me using drugs for those. Instead, I waited until I was done the antibiotics, my body had a chance to recover, and then I went and had the test today. And he was, the doctor, and he's a really great guy. I just want you to know that he's a really great guy. And I knew I was going to confuse him because he's not used to people who control their own health. So I went, I had the test, and the results were exactly what I expected. I didn't have any residual from the infection. I didn't have any of the things that he had suspected on our initial visit. None of that existed, and he was very surprised at that. So just think about that. If I was an individual, like most of you are, you go to the doctor, you have a situation, they give you a drug, they tell you to follow up in a couple of weeks, they book you an appointment for a test, they do the test, and they take the results of that test as if that's going to be who who you are for the rest of your life, not giving your body any kind of chance to intervene. And then once you're on those drugs, what next? No one has a clear answer to that. And of course, in Western medicine, we have specialties. I found out today that there's actually somebody who's like an ophthalmology vascular surgeon. I didn't know there was such a thing.
That's a mouthful.
That's a mouthful. That's why I had to think about it. So it's somebody who's an ophthalmologist, an eye doctor, but he literally specializes in the vascularization, the blood flow to the eye, and surgery that would be needed around that. It's such a I don't know what, maybe accidents, maybe some I don't know even where those patients would come from, but so specific and so specialized. And we live in a world of specialties. So you have this problem, you have these symptoms, you go to see this specialist. You have these symptoms, you go see this specialist. And if there's not a whole lot of communication between those people, you could easily end up on a bunch of medications because this person prescribes for the symptoms that you have, this person prescribes for the symptoms that you have, and now all of a sudden you have the possibility of conflicting medications. Now, here's the deal. In Canada and the United States, we're supposed to have computer programs at the pharmacies that are supposed to catch any drug interactions, potential drug interactions, and flag them and call notice to the pharmacist. So a little red thing comes up on your screen, it flashes at you, says potential drug interaction. So the job of the pharmacist at that point is to review the medication and evaluate the interaction, the potential of that being some kind of nasty interaction, and you can override that and dispense those drugs. So that's the role of a pharmacist, and it's really one of the reasons that you go to a pharmacist, and it's one of the reasons why we go to school, is to become drug therapy experts and know about interactions and things that could cause you further harm. But my whole point to this is the practice of medicine to me has got way out of hand, or the expectation, and it's the expectation by the medical profession, it's also the expectation of the patient that everything can be solved with a pill. Just think about this for a second. The last time you cut your finger, did you think about anything that you needed to do to heal that?
Absolutely not. I just got a cut actually the other day when I was making my breakfast by aluminum foil, and it fracking hurt. It was not fun on any level, but and I couldn't do dishes, like hand wash dishes for a couple of days, and every time I hit it, it was really painful. But I didn't even put a Band-Aid on it because I knew that it was going to heal, and if I just left it alone, my body was going to heal itself, and I didn't have to think about it.
So this is one of the contentions that I have. Medicine, sometimes we think it moves slowly. Sometimes it moves too quickly. It moves to this point where we are not giving our body a chance. And so we have to be the discerner here of giving our body a chance. So I had a raging infection. I knew that. The symptoms told me that. It was acute, it was sudden, everything. It was just an infection. And I knew it was just an infection. And if I hadn't have taken control of that situation, I literally right now would be on like 3 or 4 medications at the recommendation of the doctor. Had I not waited, given my body a chance to heal, supported it with the appropriate supplements, which we could talk about, but you have to support your healing, also supported it with rest, and supported it with some meditation and so on.
I think for just a second, I want to go back to what you just said about rest, because I think one of the big, huge things is in our society in North America, we actually really don't honor our self-care time. We generally, most people in North America, I can't speak to people in different countries because it really depends on the infrastructure that the country has created for people. And in some countries, they get, as soon as you get hired at a job, you have 8 weeks of vacation and they get lots of time. And then there's other countries where you can't leave until the boss leaves. And so you're working 12, 15-hour days, whatever it is. But in North America, essentially the way that it works is you're expected to work 5 days a week. You get 2 days a week off, and those 2 days a week you're spending time with your family, you're running errands, you're doing laundry, you're going grocery shopping, your kids have extracurricular activities, and really in all reality, you're run off your feet 7 days a week, and you do not get any downtime unless you get sick.
Yeah, that's right.
And your body forces you to rest. So I have, of my own volition, realizing how important it is for me, being an entrepreneur, doing as many things as I do, I give myself one no brain day. And that literally means I'm not doing any work at all. I'm not taking clients. I'm not working on my company. I'm not working in my company. I'm not socializing. I'm not doing anything except for going for a walk and enjoying nature, or curled up on the couch with a blanket and a cup of tea, whatever I feel like doing. But I'm not texting anybody. I'm not socializing with anybody. I'm not going out and connecting with anyone, and I'm not working. And if I try to use my brain, my son and my boyfriend actually have permission to slap me, because I generally tend to want to. And it for the first little while when I started doing it, it was really hard on me.
You feel guilty.
But when people get sick, exactly.
You feel guilty.
I have actually gotten over that. I've let go of the guilt. But that is something that a lot of people struggle with. But I really wanted to quickly speak to the point that Alan was making about the rest, because more often than not, with the amount of pressure that people have on them to perform, what happens is their body tells them, I want to rest for one reason or another, depending on what the health issue is, and they don't want to take the downtime to heal at all, and they're looking for the thing that's going to allow them to actually be able to just get back to work.
That is exactly how we became dependent on prescription medication. That is exactly how, because in America, we have this idea that we need to work. We're all evaluated on our work ethic. And you know, when I come to Harmony's, I drive through what's called the downtown east side here in Vancouver, which is it's a ghetto. That's what it is. It's a ghetto. There's 5,000 drug addicts, people living on the street. And it's a really super testament to people that literally can't handle life and they check out. They go live on this. It's easier for them to go live on the street. I know there's many social problems and mental health problems and all that. I'm simplifying this, but literally most of us are like this. We're like a really hot Ferrari, and we're on a freeway, and we want to go as fast as we can, as far as we can, but we run out of gas, and we just won't get off the freeway. I mean, we just will not get off the freeway, and then our body shuts down. We have to get off the freeway. So this is where medicine stepped in and said, well, we'll give you something to take your mind off of the symptoms. Nothing to do with you healing your body. We're just going to take your mind off the symptoms, and you can get back to your busy life. And what that leads to is a huge crash at some point. It just leads to a huge crash. So many of the people that were in the hallway waiting for tests at the hospital where I was today, I was in the outpatient clinic, you could tell that they had crashed. They had literally not taken any time. They don't even understand that. And it took me a long time to learn that too, that when your body is sending you a message by getting sick, by dis-ease, when your body's sending you that message, you need to afford yourself some time to rest. And whatever that is, maybe it's 20 minutes of listening to something where your mind is completely relaxed and your body's completely relaxed. I'm not talking about maybe hours and hours of it, but just something that's your time. When I had my stores, I had 3 drugstores and 200 staff. Everybody knew when my door was closed in the middle of the day, I was having a nap, and nobody interrupted me. I took a nap every day at work with 3 stores, 200 staff, and all the activities. And yes, if my staff ever came to me and said, you know what, I need to take a nap, can I borrow your office? They literally could go take a nap, because they were more important to me long term than making them sick and then losing them for 10 days or 12 days or 14 days, whatever it was. So a 20-minute nap or 30-minute nap. And we had an arrangement. Everybody covered for everybody else at our store. It was really a lot of fun. And some people never took a nap. I mean, there's just some people that never felt that need. But the people that were in the management positions and all of that kind of stuff, every once in a while you just need a break. You just need to get away from everybody who's asking you questions and talking to you and this and that and whatever. You know what I'm talking about, because many of you have been there. So I would take a nap, even when I had my stores. So rest is so important. And
sometimes too, just getting out of the environment too. One of my clients, she does accounting for Shoppers Drug Mart, big massive company.
Yep.
And every day at lunch, her and one of her coworkers go for a walk, and they get out of the store and they get out in fresh air and they go out in nature, and it's her way of de-stressing every day, and it gives her brain a break. So even if, you know, there's a lot of stress at home and you've got kids and a husband and a house to clean and cooking and all that, and you can't take a break on your day off because you know you're going to have to do all of that, if you can make your lunch break an actual break, if you get long enough and you can go and get some fresh air and be out in nature and stuff, then maybe that's the option. But figuring out where you can make, or even just carve out a little bit of time every day. If you can't do what I do and take the whole day off where you don't get to use your brain. I mean, I'm in specific circumstances where my son is now 20 years old, so he's not relying on me for as much in regards to his daily needs, whereas for those of you who have little kids, it's a completely different circumstance. And obviously for Alan at the time when he was doing that, he owned his own business, so he created the culture that allowed for people to do that, and he was able to give himself that space. That being said, he was still working, 100 hours a week?
Yeah, I worked 100 hours a week, so I needed naps.
Yeah.
I definitely needed naps. And, you know, and a lot of my staff would work extra hours without me saying that, because anyway, we just created a great culture at the store. As you can imagine, my managers, the people had to come first, and their health, and they need to go for their kids. Like, we just made it work. And of course, I'm probably pretty unique in that regard, and I know that many of you have jobs where there's no level of compassion in that regard. But anyway, that's actually how pharmaceutical medicine got such a grip on us, and we became so dependent, is because it allowed us. There was an article in Fortune magazine a number of years ago. There's a picture of a beautiful lady walking. She's holding her toddler. They're walking down the street, and it says, "Your company doesn't much like your kids." And the whole article is on this whole idea that, you know, if you're a woman in the workplace, you need to be there, be, you know, this superwoman, superhero, and, you know, your family wasn't to be taken into account. And that was a culture I just didn't want to create. So, but I'm not here to build myself up. I'm really here to talk about this pyramid, because I really want you to understand this so that you will feel enabled to take control. So where we see this the most is in really severe diagnoses where people their life is threatened. And so I've been in this case too, where my life was threatened, and I didn't know how things were going to turn out. And I knew, you just know that your body knows how to heal. Harmony's finger healed without it. You know that your body, if you give it some time, it will hopefully heal. Actually, when my first encounter with this, I was 30 years old, and I didn't really have any option. I mean, I had to rest. I couldn't do anything. I didn't have any energy to do anything, and I literally told Donna 5 nights in a row that I was going to go to sleep and not wake up. That's how little energy I had. I thought, if I get to go to sleep, I'm just going to sleep, and that's going to be it. And so, you know, faced with these sort of situations, and I've learned through this that, so rest, but this pyramid of, once you take a step into this field, and many people do because they don't have the option, and I understand, but I just want you to know that once you're on one drug, it's like the pharmaceutical industry knows it's just a period of time, and you're going to be on 2, then you're going to be on 3, then you're going to be on 4. And most people don't know this, but pharmaceutical companies have actuaries. Those are people that do lifestyle and life plan statistics. And depending on when you were born, where you were born, and what job you have, they actually predict how many drugs you're going to take and be on by certain points in your life. That's an actual fact. That's actually something that they look at. And they actually also predict the progression of, or the risk factor of diseases. So one of the big things about the Genome Project and this whole idea about your genes, and we read your genes and we're going to predict your future as far as your health risk is concerned is the pharmaceutical industry going, gosh, if we can get people faked out by their genes, then all we need to do is create drugs for each one of these conditions or surgery or whatever that you've seen people have. And this, I know this is a really big topic and it's probably really controversial, but it's just really fresh in my mind today that you can take control of your health. You can take back your health. Just remember that the person that you're talking to is trained in a particular way. I'm looking around the hospital today and I know that I'm surrounded by really, really intelligent people. They had to work really hard, be really brilliant to get into medical school. There was no dummies around there. Those are very, very intelligent and smart people. They were put into a system that taught them a specific way to practice medicine. It didn't teach them anything outside of that, and it really doesn't teach them much about health. I was there, I was in that, I know it. It just teaches you this, once we get on this gravy train, if you will, that's the course of life, and they start to predict. By the time you're 65, 66, you're going to need this medication, you're going to need that medication by the time you're 70. And so I'm so passionate right now about you stopping and taking control of your own health. Just sitting back and giving yourself a minute and thinking about all the things you've recovered from in your life to this point. All the colds, the flus, all the things that you've encountered in however many years you've been alive, and even your kids, however many years they've been alive. And yes, maybe they've needed some medication temporarily, but you think of all the things your immune system has overcome. I think about it, I'm going to be 67 in February, and I think about all the things that I've been exposed to, stuff that I didn't even know about, that my immune system has taken care of. We are an incredible, incredible healing machine.
Yeah,
we are
absolutely.
An incredible healing machine.
We underestimate.
We totally underestimate the power of our body to heal, the power of our mind to intervene. We're not taught these things. We're not given any tools in this area.
There's actually a really cool little story that a wonderful friend of both of ours told me a story about. And he told me the story about it like a while ago, and then we referenced it again fairly recently because I used his story in the treatment room with my clients. And he actually had been injured and had a scar pretty much the length of his thigh. And he has gone on his own journey to discover the power of his own healing. And he actually worked with somebody who did energy medicine and did energy healing. And he released the trauma, the emotional trauma that was associated with what caused that scar. And the scar went from being this long up his thigh to this long.
Wow.
So it's really interesting because Alan, knowing and understanding how it is that this works, and we've talked about this before, the body renews itself every 7 years. The skin renews itself every 30 days. So I'm trying to figure out exactly why it is that new skin cells that are at the deep dermis level are being created with scarring. So that every 30 days you have scar tissue that is being created and coming to the surface, to the epidermis. That literally makes absolutely no sense to me. And Alan, when he went to school, when he graduated, he wrote his thesis on how does the body know to stay sick. And when we understand that the body is constantly renewing itself, then that means that the new cells that are being created in the body somehow are being created sick. And there is so much amazing information out there. Bruce Lipton is one of the amazing people that are at the leading edge of this information, and he's a biologist. And at the time when he was researching in his lab and teaching biology, the information that he discovered back in the day was conflicting what it was that he was actually teaching, which was that the individual cells don't have any programming when they're initially created, and then they take information from an outside source and they become what they are told based on the proteins that they get to become. So if they're being created in an area that actually has scarring or sickness or illness, it will take the information into its receptor sites and it will say, okay, so I have to become a sick cell, and it becomes that sick cell. So this is how that actually gets duplicated. So we have the power because our body is renewing itself all the time to release the vibration of what it is that is creating those sick cells, the scarred cells, or whatever it is. And then when that new cell is created, it won't receive the proteins that are dictating to it that it needs to be scarred, injured, sick, or whatever it is. And you can actually release that sickness or the scarring, which is why Kaiser was actually able to successfully shrink his scarring. So this has been scientifically proven for how long? When did Bruce Lipton discover this?
Right, he started talking about it in the late 60s, early 70s. He wrote his book, wrote his paper, and because at the time everyone was talking about your genes determine your destiny. It's in your genes determine your destiny. You're stuck with your genes, too bad for you. If you got good genes, you got bad genes, too bad for you. And that is completely untrue. The environment actually controls. And that's what he was clinically proving, and many other people have since clinically proved that it's the environment. He gives the example of the gene for breast cancer that many of you have heard about. And first of all, only 50% of the women who present with that gene get breast cancer, and a very small percentage of them die. But what is the environment that, if you take that gene expression and you put it in a particular environment, then it expresses itself as the cancer. And there's a particular environment to that. There's another work by the two physicians, Hammer and Hammer from Germany, where they outline specific traits, emotional traits that would lead to specific cancers in the body. Testicular cancer in men, cervical, breast cancer in women. It's a very specific study. It was done over a period of years, and the information was so dramatic, it was held back from being published in English for many years by the FDA. And you can now get that. You're going to be bored to death. Just to let you know, you're going to be bored to death. You want to read just the highlights of that study. It's a big, thick book, about like that thick, but they literally predict with accuracy, 99% accuracy, if you're going to have a cancer based on an emotional event in your life. It's pretty cool. So, yeah. I was just thinking about. I was wondering whether I should tell this event or not, but maybe I'll save it for another. Maybe I'll save it for another time. So the whole idea that we have no control. That's what I really wanted to stress to people tonight. You actually do have a say in your own health. You have a say with your physician. For instance, when I was booked 2 weeks after this event to go for the test that I had today, I said no, I'm not going. That's too soon. One of my friends who had a bone cancer, she decided to take flight. And I said to her, well, you don't have any kind of scans when you come back. When you fly back here, don't book any scans for at least 30 days because your body's going to be full of lesions, your bones. If you think about the environment of an airplane, we're breathing, we're reusing everybody else's oxygen. And you're very, very low oxygenated, so you're hypoxic when you get off the plane. Your bone marrow is going to show lesions of hypoxic. Other tissues will too, but in this case it was bone cancer. Your bones are actually going to show lesions. So I said to her, don't do that. You've been in a pressurized tube, you've been under pressure with no oxygen. She had a scan 2 days after she arrived back, and she had 34 new lesions according to the scan. That's exactly what I wanted her to avoid. And of course, her treatment plan completely changed because of that. Because she didn't allow her body the time to adjust and give it the environment to settle down and adjust. But that's her choice. But you if you want, and there's so much information now. Dr. Bruce Lipton is one of my favorites, but there's so much information out there.
Dr. Joe Dispenza.
Dr. Joe Dispenza. Greg Brayton. There's a lot of people now that are talking about
Dr. Bradley Nelson.
Dr. Bradley Nelson, yeah, emotion code and body code.
Dr. David R. Hawkins.
David R. Hawkins.
And notice how there's a running theme there? They are all doctors.
They are all doctors. Yes, they are.
Which is incredible that people that all have their doctorate in one thing or another are all speaking about how the body can actually heal itself. And they're all different types of doctors spanning across the board, which is absolutely spectacular. There's another one, Dr. Farghani, that we absolutely love. And I have had the pleasure to meet. His wife is incredible as well. and he worked as an emerge doctor for 30 years?
Mm-hmm.
And he had another pharmacologist who actually had started his own clinics to balance hormones. He actually created a clinic called Ageless Living, and he wanted to help naturally balance hormones using bioidentical compound pharmacy, which is next level. It is absolutely incredible. And he bugged Dr. Farghani for about 5 years before he actually got him to concede and look at the work that he was doing, because he originally thought that it was kind of woo-woo juju and wasn't really into the naturopathic stuff. And then he decided to take a look at it, and he decided to abandon his practice to create a practice with this other guy, Michael Forbes. And they worked together in using the bioidentical compound pharmacy to balance people's hormones, and they are doing saliva testing to get these answers. And we got to watch a lecture that they did educating about how they do this work. And I recommend these guys to my clients all the time to help balance their hormones, because there are so many people. There's an absolute epidemic of women who can't get pregnant and are dealing with infertility and health issues, and clients who are in their 20s that have cystic ovaries and uterus and all that. It's incredible. Cysts in their breasts. The list goes on. It's incredible.
Well, and one of the things too that you run into in the medical field is they run out of answers. So it gets to the point where we don't have another medicine, we don't have another surgery, we don't have another answer for you. And that's something that really I felt really strongly about when I was practicing is there's no worse news that you can get from your physician than we don't have any answers, because we're relying on them to be the hero in our story, if you will, and provide answers. And when they come back and say, there's no answers, and that's devastating to people, but there are answers.
It's actually the best thing that you could possibly hear, to be honest, because that's what happened to me when I had my concussion. They just kept prescribing me drugs for the symptoms, and I wasn't willing to take any of the drugs. And when I told them, what are you going to do to heal my concussion? They're like,
we don't know.
We don't know.
We don't know.
We actually don't know. And then they sent me to a neurologist who literally told me they don't know enough about the brain to properly heal a concussion. And he also wrote me a prescription for a first-gen antidepressant and explained to me that it was basically going to lower the stimulation to my brain so that I wouldn't end up hurting. And I was like, oh, cool, so you're going to numb my brain? That's what you're telling me. And he's like, yeah, basically that's that's the best that I can do for you. And I was like, cool, this is incredible. So I'm just going to now decide that I'm done listening to you guys and I'm going to go on my own journey. And now I sit here today, with an immense amount of knowledge about what my body needs to be healthy. And now I'm a clinical hypnotherapist and an energy healer, and I'm writing a book, and I've got a program, and I've got all this stuff going on because I went on a journey to learn about my own health and what I needed to take care of myself. And Alan has exactly the same story for himself, sitting in a doctor's office with the doctor going, I don't know.
Yeah, I don't know.
I don't know. And what happened to you?
Nothing more we can do. Well, and then I went on this journey. I was just going to say there's another gentleman who is a 32-year ER doctor at one of the most famous hospitals in Canada. And he is the first person to actually, in the ER, start optimizing glutathione. That would be that's one of the very first things. He started this a number of years ago. When patients come in, the very first thing they would start to do is optimize the glutathione.
That's incredible.
He's insistent on it. He's now retired, but he was insistent on it. He's written some books. But it was actually an ER doctor who learned about glutathione, studied about it, realized what it was, realized that most of the patients that were coming into his ER didn't have optimized glutathione, and they were going to do procedure, they were going to do things, but he started right in the ER, optimizing people's glutathione. Incredible guy. Really love him.
But that was how you discovered optimizing glutathione in the first place, was because the doctor said to you, I don't know.
I don't know. There's nothing else. I was on 9 medications at the time, and basically it was go to another doctor and get like 3 or 4 more meds. I've been down this road, the road I'm talking about tonight. I've been down that road. It's not a pretty road.
And you were 30 something, right?
Well, the first time I was 30, and then the next time when I came back with a vengeance, this infection I had in my brain, and they kind of preceded that thought. Now that I think about it, because they told me when I recovered at the time, you never get rid of this thing and it can come back anytime. And so went through another stressful time in my life, and I had another incident of that, and that's what put me on all these meds. And then the doctor wanted to send me to a psychiatric rheumatologist. In other words, I had pain that he couldn't explain. That's rheumatology. It's one of the things we just can't explain it. So we can't explain it, but we think you're crazy. And so I wouldn't go there. And I actually, that's when I took the step of starting to control my health. And I went, I have the opportunity to give myself space. So even though I was being told everything was critical and you could die and you could do this could happen and that could happen, and if you went off your meds, this could happen, that could happen, I went, yes, but what's happening right now? I'm not getting any better. I'm not getting any healthier. I'm losing cognition. I'm losing body functions. So I'm not getting any better. So I was in this really opportunistic moment in my life where I had the path to choose. I could continue down the more medication route and be in that pyramid, which, it starts with one. It's kind of an upside down pyramid. It starts with one and it just widens out. And I probably would be on 15 or 16 meds now if I had chose that route. Or I could go, is there something else I can do? And one of the things that I really realized is that we don't give ourselves the benefit of time. And literally often we're told we don't have the benefit of time. You've got 30 days or 60 days or 90 days or 120 days or whatever. But you have the benefit of this moment. You have the benefit right now. I have someone who is really close to me, who was given 6 months to live. And my very first visit with him, I said, first of all, if that's true, we have 180 days. Let's make every day count. Let's make this day count. Let's just draw out a plan for the next 120 days. And we did that. And I just want you to know that he is like 14 months he's 14 months beyond his expiry date right now.
Oh gosh, that's so horrible. Expiry date.
Yeah, well, the doctor says you got 6 months, you're gonna die around this time. And I said, first of all, you got to get rid of that thought. You haven't given your body a chance yet. And if you keep that thought, you will die.
It'd be really great if they actually didn't give you that expiry date, that time frame at all, because it totally puts you in that headspace.
Yeah, totally, right? And it puts you fear. It just drives the fear into you. So anyway, we worked through that, and we got him on a program with his doctor, by the way. I was working with his doctor. I wasn't working against his doctor. I wasn't taking him off any of the meds that were recommended. I was just saying, let's give your body support. Let's give it a chance. And we did that. We gave him a great program, and now it was 6 months, now it's 14 months beyond that. And another individual that was given 6 weeks to live, she's now 3 years past that. So even though you're being told you don't have the benefit of time, you have the benefit of this. If you become the only thinker in your universe, if you become the only thought process in your body, you have the benefit of this moment. And what can I do in this moment to make myself feel better? What can I realize about myself? And so I've asked myself these questions. I remember making this decision to go off all my medications, going, what's the worst going to happen? I can get worse.
9 medications.
9 medications. But I can get worse. Well, I'm getting worse.
So you literally had nothing to lose at that point.
So I had nothing to lose. So I stopped all the medications. I went through the DTs, 36 hours of sweating and vibrating and all that kind of stuff. It was really cool. I highly recommend it for anybody who's short on excitement. Actually, what happened in the middle of that is I said to Don, I'm going to go up all my meds, and if I get really out of hand, I'll call you and just take me to the hospital. So I started hearing voices and sounds and all of them, seeing lights and all that kind of stuff. And I thought, oh, wow, I am losing it. So I went and got Donna, got her out of bed, said, you got to take me to the hospital. I'm seeing lights and hearing voices, and it's weird. And so she went to get the car to keep me, and she comes back in and she says, they're actually taking a drug house down like 2 doors down from us, there's a helicopter above our house. There's SWAT team all over the place. There is lights, there's voices, there's people.
So you weren't hallucinating.
I wasn't hallucinating. I was actually live streaming this SWAT takedown of the drug house a couple doors down. But anyway, that was a real cool thing. So I lived through that. I went through the sweats and the shivers and all that kind of stuff. And then, you know, I said, I want to know who I am. I want to know what's left. Seriously, I want to know what there is to work with here. And is it true? Like, am I only going to live like till I'm 60 and check out or be in full-time care? And why would is that true? And so here's something I really discovered is that when you start making these decisions in your life, you find out something. First of all, you're really resilient. Let's all give ourselves a pat on the back. You have lived to whatever time you've lived to right now. You have gone through a lot of stuff. Whatever that stuff is, emotional stuff, physical stuff, whatever it is, you've gone through a lot. Even if you're 15, 18, 20 years old, like Harmony's son, you've gone through a lot. You've been to school, you've been embarrassed, you've been put down, emotionally, you've had a lot of challenges, and you've survived to this point. So you are resilient. Can we get that? Can we all understand? We are very resilient. Our body wants to live. It doesn't want to die. It wants to live, and it wants to be emotionally happy. So that's the first thing I had to realize about myself. I'm really resilient. I am actually really resilient. When I think of what I went through with the brain infection, with having all the stress of 200 employees in 3 stores, working 100 hours a week, all the stuff I put myself there, and I survived. So I'm really resilient. You're really resilient. No matter what your situation is right now, you're really resilient. Give yourself a break and then start this process of, I have time. I do have time. I have time to think about this. So there was a medication recommended to me today, and here's how it was introduced to me. There's nothing wrong with me. I want you to know that. This doctor really didn't know what to do because he was so confident he was going to find a different result than he found. And I was so confident he wasn't because I knew he wasn't. But he was so confident he was that he was really confused when he didn't get that result. And I don't know how many patients he'd had before me that he'd done the same thing with, and here's your results, and here's your prescriptions, and see you later, follow up with me in a month or whatever. So he's like looking at the papers in front of him, and he's like, well, I think you might benefit from this drug. I'm going to give it to you, but I want you to know that it causes dizziness, orthostatic hypotension. That's when you stand up, your blood pressure goes down and you actually can fall over. So it causes dizziness and headaches, so I recommend you take it at night. And I'm like, actually, what is it going to do for me? Like, besides that, is it really beneficial to what what you thought I was going to have here? And he couldn't answer that. He's like, this will just, I think it'll, just make things work better. And I'm like, well, I don't know how it can work better. It's working perfectly. So
yeah, exactly.
Right. So we didn't go down that route, but just that little installation of fear, that they would try to put it, like, he could not let me go without writing out a prescription. He just couldn't go, you know what? Good job, man. You recovered.
This isn't the first time that you've had a prescription written for you when you were looked at and seemed to be totally healthy.
Yeah, that's true.
It really surprises me.
Well, that's what they're trained to do. And once again, they're really intelligent people, but they're trained that the people want medication. They're not. It's really unusual for a patient to say to them, I don't really need to go down that route. I'm gonna give my body time. I'm gonna heal myself. I can do that. They're just used to people going, what's the pill? What do I need to take? What is it I need? I'll go down to the pharmacy and get it and get on this, and it's gonna be all good.
Well, if you can get a diagnosis, it makes it a lot easier because then essentially you're dealing with and there's an answer. But if there's something going on and there isn't a label that you can put on it, well, then you're left going, well, there's no diagnosis, so there's no answer, so what do I do? So it's so much easier to deal with, a label and a solution than not having one. But I mean, essentially that's what you were dealing with at the time when, it was really clear that you weren't going to go on chemo because you didn't have cancer.
Yeah.
So, you know what I mean? Like, obviously I knew at the time that I had a concussion, but
you didn't need an antidepressant.
I absolutely knew that an antidepressant for a concussion didn't make any sense whatsoever because I was not depressed. So, I had to go on a journey to figure that out. And actually, speaking of that, what Alan is saying is really, really important, but I just want to speak really quickly to, what dealing with health issues does to your psyche. And, depression is one of those things that very much can come with having a prolonged illness, or being in pain for a prolonged period of time.
Especially pain is very depressing.
And, I really want to support any of you guys that are going through something like that, that are listening to what Alan is saying and going, I don't have it in me. I actually don't believe I can heal. I've been going through this for so long, I don't even know if I don't know. And if that's where your head is at, I'm going to tell you right now that one of the reasons that I got through what I got through was because Alan showed up in my life. And he was my unconditional loving cheerleader. And he absolutely supported me when I was having my meltdowns and I didn't know where the answers were, and I had my rough days and I was looking for the next thing to help me next level my healing. And, I really would encourage any of you guys that are having a moment and are feeling lost and are struggling, feeling down, and maybe have a bit of a despair anchor and you don't know what to do, and maybe you don't have the energy to invest in yourself and to go and find those answers because you're overwhelmed with what you're dealing with health-wise. And I completely respect that. So if you guys can find yourself your own cheerleader, that person that has the will to live, that has the passion, that has the energy, that has the drive, that has the mental capacity to help drive that journey to health, if you can just say to that person, you know what, I don't want to live like this anymore. I want to be healthy. Can you cheerlead me to health? Can you support me when I'm having a hard day? Can you help kick my butt and maybe help me find answers so that I can change my life? Get that cheerleader to support you and hold space for you until you get to the place that you want to get to. The healing journey is not meant to be done alone. It is not. Throughout the history of humanity, we have always come together to support each other. Ancient societies gathered around a fire and danced and told stories and healed together. And the women would rend tent together and the men would hunt together. All throughout history, we've come together to support each other. And this is a time in all of humanity that we are more alone than I think that we've ever been, because we're separated by technology and our houses and our jobs and everything. So, really, really, acknowledge that for yourself and know that you don't have to be alone. And it's not a sign of weakness to ask for support. It's actually a sign of strength. Anybody who shows up in my treatment room, I immediately congratulate them for being one of the strongest people I have ever met, for showing up and allowing me to hold space for them to do the work. So, I totally honor all of the scientific information and all of the encouragement that Alan is giving you guys to be empowered to go on a healing journey and to understand how resilient your body really is. But I also want to speak to the other side of it and, how difficult it can be emotionally for you guys to be dealing with that. I've been there and I've done that. And I really encourage you to get yourself a cheerleader to help you to lift yourself up until you're in that place where you're ready to do it yourself.
Yeah,
Alan, you were totally that for me, and I'm so grateful for that, because I wouldn't be where I am today if it wasn't for you.
Yeah, well,
there's no two ways about it.
You're welcome. One of the things, if you feel really alone and you don't have anybody, I'm going to recommend that you download Louise Hay's book, You Can Heal Your Life. It's one of the simplest, easiest books to listen to. And if you just don't have any juice in you, you don't know anything else, you can download her book. It's so incredibly engaging to listen to. This is a lady who literally took control of her life at around age 75. So she'd gone through sexual, anyway, I won't tell her story, but she created a $1 billion company basically from age 75 until she passed away in her 90s. And she just made these decisions. She just like Harmony was talking about, she changed the environment that she was in. She changed the people she was around. She started to be really self-aware of her thinking. Why am I thinking that? whose thought is that? Where did I get that? When I'm driving and I'm upset, like who's in my brain? But it's a really great tool to get you started. And if you do that, that's something you can do on your own, and it's very supportive. And then once you change your thinking about yourself a little bit, I'm going to promise you that somebody is going to show up in your life who's going to be there for your healing journey. It's absolutely, that's been my experience. I've had people show up for me, giving me unconditional love. Certainly Harmony is one of those people. As I've gone through stuff, turning over the clock, and you confront these, sort of age-related moments in your life of turning 60, turning 65, doing this, doing that, and those are emotional moments. And one of the emotional moments for me is the fact that I have now outlived my father by 27 years. My father was gone when he was 40, and I outlived him for 27 years. And I remember turning 40 and just kind of losing myself a little bit there, because I'm feeling somewhat guilty that I was outliving my father. And why did he have to go? I mean, that's a big question. But so we're all gonna always confront some emotional stuff, and we need that person, or maybe it's a group of people. The thing I don't want you to do is get in a support group that reinforces whatever it is that you think you have.
Yeah.
They're just the worst. I never went to any support group that was suggested to me. When I was misdiagnosed of having cancer and they wanted to give me chemotherapy, a few years later I went and volunteered at a cancer center and talked to people and discovered, the sort of the ins and outs of that. But their support groups were there, and they kept reinforcing that you have this. It's like you are the cancer, and you're not. The cancer is just something that's going on in your body. You're not the cancer. And so I don't find them generally very helpful in getting healthy. Now, some people might argue with me, and that's fine. They might have found a support group that's all about getting healthy and getting well. And yes, you have this condition, and we're going to get well together. That's really super duper. But many support groups are there so you can report in on your symptoms of that day and how bad it was, and you can just sort of unload your emotions for that day. That is not support at all. That just furthers your investment in keeping yourself in the same place. So really be careful when you're choosing a support group. If you're going to choose one, I prefer individuals, people that you can sit down with. And like I say, if you don't have anybody in your life, we live in the world of technology, and you can get somebody that is really, who went through the journey herself and recovered and created a billion-dollar company. So that's a pretty good testament to taking control of your life. So, that's kind of the topic I wanted to get on today, because I was very passionate about it after having been at the hospital, going through this experience, having given myself the time that I needed to heal. I literally let go of all of my obligations pretty much for a month.
Yep.
There was a few that I couldn't let go of, but I literally let go of all of my obligations for about a month, because I needed the space, and my body needed that space. And I'm so grateful that I know those things and that I was able to do it. If you can't, there are programs, 20 minutes. Give yourself a break for 20 minutes. You got to start somewhere. You have to start taking care of you. You have to start taking care of you, because I will tell you, in the medical world, you're a statistic, you're a chart number, you're not a person. You're a disease that needs to be controlled, that needs to be managed. And you don't have any personality, you're not a person in that. It's great if you come across a personable physician or a personable, but literally, you're a chart number. So after my event today, when I'm like, I'm actually really under control here, I don't really need any medicine, all that kind of stuff, and he gives me the prescription, which he knows I'm not going to get filled. He says to me, well, hey, listen, you can always call me. You were referred to me. He's a specialist. He's a really nice young gentleman. I know he's really smart. He's a really nice young gentleman. He's just not used to somebody like me yet. And he said, so, if something acute shows up, please call my office. I'd be happy to see you again. If not, come back, check in with me 6, 7 months, 8 months from now. I'd love to know how you're getting along. And I just might do that, because I might just really enjoy going in and saying, I appreciate your time and what you gave me and the opportunity you gave me. And I want to make this point too. The reason I followed through with this test is I understand I understand the healthcare system we have, which is actually a sickness care system. It's not about health. But when that was recommended, because I had an acute event, I had to go to the ER. I was in the ER for 2 days. So I had this really acute event. And they recommended that I see this urologist. So I followed through with that, and then he recommended this test. And the reason I did that is that now goes on my chart. I cooperated on all of that. So I'm not a non-cooperative person. I don't want to give that impression. And I don't want you to get into that space of, I'm not going to do whatever it is. No, I cooperated because now it's on my chart that I was there and I'm healthy.
Yeah.
I'm like, I don't have any symptoms. This thing is gone. It's done. I'm done with it. And so now, he's essentially got to put that on his chart that I'm, much to his surprise, I'm something that he never thought I could get over. I'm over. And so I did follow through. I wanted to make sure, and I will follow through with my personal physician at some point, and we'll have a chat about it. And it's just, that's the way to keep a good relationship with your physician. There's some things that maybe I wouldn't do, but I have followed through on things, and I've always been happy with the follow through because it always tells me that I'm way healthier than anybody expected me to be, certainly at the age I am. And it shows to me that the things that I talk to people and teach people actually are working. They do work. I'm a living testament to it. I've experienced many things that you're out there experiencing. I've been through it. And I have a foot in both of the fields, if you like. I have a foot still in medicine and what medicine can do. Medicine has done wonderful things. But I also have a foot grounded over here in what we can do. Our emotional, spiritual life and how important and integral that is to how our life turns out for us. So anyway, I'm really, really grateful for everybody who's supported me. I'm grateful for the journey I've been on. I'm not angry about anything. I'm not angry that, at 30 years old I could have not made it. I'm not angry about anything. I look at it and go, you know what, this has been an incredible journey, and what an opportunity I have now to help others and encourage them, and be with somebody who I have encouraged, who's now my cheerleader and helping me in areas that I literally have no skill in. So great partnerships and great friends make for great lives.
I have to say that I did exactly the same thing, even though I didn't get the answers through my doctor when I was trying to heal my concussion. When I did find the answers and what it was that worked for me, I was happy to go back to my doctor and tell her exactly what it was that did work for me in supporting my body healing. And what was really fascinating was she wasn't surprised, because my doctor is Asian, and Asians know about collagen. And so when I talked to her about the collagen I was taking these guys, the Provita, she was like, yep, Chinese people know about collagen. We consume it all the time. It's really amazing. But of course, she's not allowed to prescribe collagen protein to me. That's not a thing that she can do. And she can't even tell me to go and take it either. Yeah. So I had to go figure it out on my own, come back and report to her what I had done. And she was like,
they get the pat on the back.
Yep, it totally works. You're totally right. I was like, wow, cool. It would have been so amazing if somebody could have hinted. And then of course I optimized my glutathione, which really supported me getting my cognitive function back. And I went back and reported that as well, to no surprise again. And it's absolutely amazing. So, I totally encourage any of you guys, if you find answers, for sure, go back and let them do the tests and let them, see how healthy you are and let them know what worked for you. But, we've talked about this before. Doctors aren't going to prescribe anything natural to you. They can't.
They can't.
And really, when push comes to shove, they have 4 hours of nutritional education over the 10 years that they're getting educated. So they're not a specialist in that. In fact, I don't know how many times I've gone to see a doctor for when I've been sick, and they've told me to drink Gatorade. So I I mean, they may as well be telling me to drink energy drinks. Like, I can't believe how unhealthy, the advice that they're giving me is. It's the last thing that I should be consuming, and I absolutely do not go and get Gatorade. But they're like, it's got electrolytes in it. Have you guys ever seen the movie Idiocracy? If you haven't, you should watch it, because in that movie, they actually water their plants with Gatorade. It's really funny. You should totally watch that movie. It's got Owen Wilson. He's the main actor in it. So thank you so much, you guys, for joining us. And I hope that this inspires you guys to start your own healing journey, or to maybe be a cheerleader for somebody that, needs some encouragement and some love on their healing journey. And, we really, really love and appreciate each and every one of you guys who shows up for us every week, so that we can support you on your proactive health journey, because all of you guys are so intelligent and know so much and ask such great questions. And I know all of you guys are so passionate about the same thing that we are, which is, not just having longevity, but really having quality of life, quality and quantity.
Yeah.
So we'll see all of you guys next week, same time, same place. And like I said, if you have anybody that's not in the Facebook community, we have a YouTube channel so that you can lead them to the Glutathione Authority YouTube channel, and they'll be able to find this here. And I've had a number of people ask us, is this live event going to be able to be accessed? I post it at the top of the Glutathione Authority Facebook page, and it sits there pinned to the top of the page until we do our next one. And then it's in the videos if you want to search it, or in our YouTube channel. Hazel Ellis said, always so informative, thank you. I had a concussion 23 years ago. I've been getting biofeedback, which has worked, along with supplements. That's really cool, Hazel. I'm really glad to hear that you're having success with the biofeedback. I never tried that myself, but it's really, really good to know that that's helped you. Allison Dan said, happy that you are better and that you listen to your body and your intuition, Alan. Thank you so much for the comment, both of you guys. So we'll see all of you next week. If you have any questions post-production, please feel free to message us on the Glutathione Authority Facebook page. Bye, guys. Bye.